name's Sain. I'm the founder and CEO of Meridio. My background before I started this company is I had another company that was in the staffing space, and we found that non-traditional workers, part-time workers, those that were in temporary jobs just didn't really have access to good quality health. So we wanted to build a product stack that helped those workers get access to affordable healthcare and doctors, prescriptions, that kind of thing. Meridio allows individuals, small businesses, and large platforms like Quick to get access to doctors nationwide. So you can think of what we are trying to do is trying to help the non-traditional worker be able to get prescriptions, doctor access, affordable care access without going through the more traditional, difficult healthcare channels. So we said, hey, why don't we build a process and program around simplicity, ease of payments, and ease of access with no underwriting requirements. So if a worker comes in, they can talk to a real person and buying coverage over the phone without any questions up front. The primary difference that we have from other providers in the space that we've really packaged the solution, the Meridio stack, I guess, from end to end. And what that really means is we started at the products and we said, what is most important for individuals on our plans to be able to do? They want to be able to talk to a doctor, and they want to be able to get prescriptions. And if something bad were to happen, they wanted to make sure that they had some type of backstop. And so what we did from there is said, okay, for this part of the workforce that's either going from job to job or is really taking gig work on demand, we want to be able to build an experience that allows them to get access to this product in a way that's easy for them. What we've done is we've built up a matching system. So a worker comes into our system, they match with what we call a benefit guide. Benefit guide to a licensed insurance person, and that person specifically trained on that product stack that we sell. And so that product stack helps that worker understand how it can help them, understands where the doctors are in their network, and then just makes it really easy to ask questions. So there's no difficulty around finding what plans right for them, finding other plans in the network that might be useful. We just wanted to give them something really easy to work with. And then after that, once they talk to the individual that can help them, the worker can then just bind their coverage over the phone so that they can pay on credit card or ACH withdrawal. So everything's super simple. And then of course the insurance is portable, so they can take it with them wherever they are. Yeah, so I'm historically not from the healthcare space. So this to me was really interesting space to get into to understand why healthcare was such a pain for people. The open enrollment period is part of that pain. And what I mean by that is that if you're going to the exchange, you really only have one chance a year to get into a plan, and that's at the end of the year in the open enrollment period, or if you have some qualifying event. And so what we said was, well, there's a large part of the workforce, this modern workforce that's a little bit more mobile, that's moving around the country a little bit more, that, they need to be able to get into these plans and out of these plans in a flexible way. So we have no enrollment period. So you can just sign up to the plan whenever you want, come onto the plan, and it kind of allows for a lot more flexibility for workers that are coming into jobs or going in between jobs. All of our plans are built on the multi-plan PHCS network. It's a private healthcare systems network, basically the largest network available in the United States for a private health plan like ours. There's a good chance that the provider is on the network, but what you would want to do is just talk to Benefit Guide. They can look up the provider network for you. And you can also go on one of the pages and look it up as well. So if you want to find out your provider is already on the network, you can check that way. So our plans are really purpose-built around that non-traditional 1099 worker. We wanted to build a plan that could take into account a lot of the needs that these 1099 non-traditional part-time or temp workers are looking for. So bringing it full circle, for us, it's that non-traditional worker that's really looking for a system and solution made for them, like really specifically thought through just for them. And that's really where we shine. So what I would say for freelancers that are really focused in the hospitality space, we understand that income fluctuates. And so maybe you have a gig where you're serving for a client, or you're a bartender for a few weeks, and you're really relying on hourly rates and tips to be able to make sure that you can maintain that access to whatever expenses you need to make, right? And so for us, we said, why don't we focus on an entry-level plan that meets those two basic needs first and foremost, which was prescription access and healthcare, and then let's start it out at a really cost-effective price point. And that's really what we've done. Our most base plan is $149 a month, I believe, and the plans can go up from there. So it gives a really cost-effective way for an individual at Quick to come onto a plan, to get access to a doctor, to do their yearly checkups, to make sure that they can stay healthy enough for the things that they want to do with their lives. And so for somebody like Quick and the freelancers that are on the Quick network, I think we're kind of a perfect match, because all you need is to be able to talk to somebody over the phone and hit that minimum payment level, and you can keep your plan for as long as you want. Yeah, so a Quick freelancer can click through to a page. They can book some time to talk to a benefit guide. That guide can bind coverage with them over the phone right then and there, and then their insurance can start the following month, as early as the following month, depending on their sign-up date. You can get started like in 20 minutes. I mean, it's super easy to do. The most important thing for us was simplicity. And so I think that starts with just having an easy conversation with somebody that cares.